Thank you everyone for joining us for another episode of Sisterhood of the Scalpel. I'm Dr. Maryam Zamani.
I'm Dr. Julie Khanna.
And we're two board-certified plastic surgeons in Oakville, Ontario, here to answer all of your questions about everything related to plastic surgery, dermatology, skincare, and life in general. And we're especially here for female empowerment and building a supportive community for one another. A lot of us have realized a lot of those in-person meetings don't need to be in person. They can be done virtually. They can be more efficient. COVID-19 has affected how we're functioning in the workplace currently, but it's also going to be a stimulus for change going forward. So I think we're all anticipating a huge rise in having these more remote communication style. We all want to put our best face forward. And so what we thought today would be a great idea is to just talk to you about when you're focusing on your décolletage above, what are our top procedures that we would recommend to make sure that you're looking as youthful and as beautiful and as amazing as you feel inside. So that's really our focus today.
So when we do this, when you come into the office, we often start from top to bottom. And we're going to focus today not on those big procedures, but what we're going to talk about are little local, smaller procedures that can really help. So let's start top to bottom. So we want our eyes to pop. We want to look like our brow is in a higher position, a more youthful position. Simple things, that's where Botox comes in. The frown lines in here and here. I love to talk to patients about opening the brow or lifting the eyes, opening the eyes up is about pulling those muscles that are pulling you down, weakening those with Botox so that the other muscles that are pulling up open up. So you just look more youthful, more brighter, and you don't have to look shocked or spocked. You don't always need Botox all on your forehead. Sometimes you just need it in two little areas to just let those muscles that are pulling you down, weaken them so that your normal muscle action can pull them up.
Well, what I want to bring to attention is that a lot of times people are scared from, especially when they're beginning to experiment with newer toxins like Botox, they're all very afraid that, you know, a lot of people think they're going to have that shocked, frozen look. But Botox isn't about having a lot of units. It's not about freezing your entire face. It's about using Botox strategically. What that means is that you need to go to someone who understands anatomy, who understands the different pull of muscles and what that does to your expressions. I can tell you that both Dr. Khanna and I have Botox in our faces. I'm going to give us away. But we have lots and lots of expression going on, as you can see. We are very expressive people, and you cannot take that away.
I think I'm Italian, Indian, Italian mix. My best friend's Italian, so I think I'm like that. I talk with my hands, with my face, and it would be terrible if I couldn't do that because I wouldn't feel like me. And it's finding that balance for every patient. So if we want a little bit more, we've got the Botox. What can we do next, Dr. Z?
Well, the other thing is, you know, you want to make sure that your eyes look open and bright. And sometimes with age, we do get a little bit of more hooding of our upper eyelids. We have some extra skin that can form. And that's a very easy procedure that we can do under local anesthesia or local freezing in the office to remove just some of that excess. We want to maintain that youthful fullness of the eye. So we're not going to empty your eyes out, make you look hollow and age, but it's just to make sure that you're able to apply your eyeliner as you want, not get the smudging in the corners, and enjoy your makeup, enjoy having bright eyes that you don't look tired. So that's the other procedure.
Patients are surprised sort of for the downtime and the investment and the healing time, which is usually about a week. With a pair of Jackie O sunglasses, you might have a little bit of bruising, but the results are so wow. And people don't know what they're seeing. They just go, you look so good. You look so rested. That's one of my favorite little procedures to do because it really has such a big impact.
I'll talk about one very specific thing that's important to me because I suffered from it horribly, and that's sunken or dark under eyes, or just a little bit of what we do for our under eye.
You've really got to attack it in multiple ways. And, you know, Dr. Sapra, our partner, who's a dermatologist, always says if there was a perfect cure, he wouldn't have it, and he has it. But what can we do? Combination therapy. Using a good product that's lightening the skin a little bit. That is critical. And there's some amazing creams that we have available that can help specifically for that light, very sensitive eye skin. But it's often a sunken area. So you want to build it up. So if you have a deep valley, it looks darker. So a little bit of filler. And our favorite is using your own blood, using your own natural substances, because filler in the lower lid gets a bad reputation. You can get those sausages, you can get that blue hue, what we call a Tyndall effect. But if you use your own natural blood, what we call PRP, plasma rich proteins, it does two things. It fills and it thickens the skin. So you're getting a really soft, natural look to improve that contour. We love PRP in the lower lip. The more permanent or longer term solution that we have is using your own natural fat. And it has that yellow coloration, which is more like concealer. And that's another awesome benefit as well.